So I am so excited to have Dr. Vertrees on the show today. She is an amazing surgeon. She has served in the military. She's deployed to very dangerous places in our world. But what I want to talk about today is how you are thriving in your 50s and you have created something new and pivoted in your late 40s, early 50s. We're going to get into that. And I think you, like me, are feeling like this is your best decade left yet. Like, I don't feel like I'm like, oh, I'm 50. Life is hard. I wake up every morning and I'm sad. Like, I wake up and I go, I am killing it in life compared to how I was in my 40s. And there's this freedom that goes along with it. So, can you just kind of give us the 2-minute overview of how you decided to go from military surgeon to I'm going to open up my own practice, and then you saw a need and now you have this niche for women in surgery?
Yeah, absolutely. Oh, thank you so much for having me on. I mean, as soon as I saw like your topic for the season, I immediately reached out. It's like it took me like 30 seconds. Because it's like, oh my gosh, this people need to hear this. And to give you the very short version, I was in the military. I went to the military medical school. I was there for Walter Reed for the heights of the war, and it's just perfect timing for just my career to help and really stretch myself beyond what I would imagine because I had no idea what was in store. And then when I got out, I did what everybody said, you become an employed surgeon. And so I became an employed surgeon and it was fine. I liked everything, but I started realizing as my contract was up and I started thinking, I just don't think this is my life anymore. I don't have any control. And I was trying to make some changes and administration was saying no. And I was like, I just don't think this is my life anymore. And crystal clear said, I'll be complaining of the same things for the next 15 years. And that just
Mm.
became intolerable to me. And I think this kind of goes into the topic of, what we have in our 50s, which is I started doing the math and I was like, I don't actually have to make safe decisions. I can take chances. I have invested enough in myself that I can stop and open a private practice. And what's the worst that could happen? I'd like go back to employed. That's always available. So it allowed me to take chances, the financial stability that advancements in our career will offer us. And that's when I think the world opened up to things I never would have guessed. So I opened a private practice, and then I learned about coaching. Never actually imagined I would become one. But then I started realizing this is the secret is really understanding ourself and what we're capable of, and understand all the limiting things that have been offered to us. You have to do this. You have to do this. And I think what was offered to me as I went along was I decide. I
Mm.
can decide what happens. And it's my strengths that I'm working with that have gotten me this far. And other people have given me opportunities, but I've taken them. And it's just the freedom of it is helpful. But there's also some resistance to it too. I'll tell you about
Oh
my
my
50th
gosh.
birthday.
Yeah, okay, you just said so many things that my mind is exploding right now because I feel like I'm talking to someone that is so aligned with what I am going through in my life and my thoughts. But I want to unpack so much of what you just said, and then I want to hear the story because you said some things that are earth shattering to most high achieving women in medicine and in other careers where you feel stuck because there is a very clear path for what you should do. You said, number one, that you realized you could take chances and that you could be risky. Okay, that's huge. And you realize that in the context of feeling, you said, a lack of control. So there had to be an inner dialogue that was going down, especially what I love about this, because I do coach a few women that are in the military. They feel like I feel stuck often in academia. They feel like rooted, like there is no option for them. Like the option for them to veer off the path is zero. So, can you talk us through? Okay, I had this feeling and thoughts of I don't like this. I'm having the same frustrations year after year. Why am I doing this? To I am in control. I can take risks.
Yeah, I think it's just because that's what we're told. And all through our training, and not just the military, but in our training, we're taught the employee mindset. People tell us what to do, and we do it. And the military, tells us more things to do. And I look back now, I mean, there certainly were some limitations, but there's even that is something that you can challenge. That we still have the ability to gain knowledge and value within ourselves, and that's what we are now reaping the benefits of, is all of the things that we have done in our career. And you can take chances at any moment, because really, what the chance is saying that it's okay for me to invest in myself, and it's okay for me to speak up. And it's okay for me to have my opinion be heard. And I think that there's a lot of fear in having your opinion be heard. But when you start realizing, like, my opinion doesn't hurt me, and speaking up,
Mhm.
sometimes we really need to speak up because we want some change in the world. And I think if more of us spoke up, one, you will realize sometimes you won't make some change. And that's what happened when I spoke up, when I found my voice and I started speaking up. I did run into a roadblock, and I did have to leave
Mm,
my job. And in the military, it was the same way. I couldn't practice surgery the way I wanted, and I was fortunate enough to be at Walter Reed, where I had a lot of choices. And now they have a few more choices because they're allowing off-duty employment. But at the time, that's what we had. And so, in that moment, I learned what I could do with what I had, and I didn't really appreciate that I had a lot more choices than I was giving myself. And
mm,
so, I'm
mhm.
hoping that all the work that you're doing, especially all the women you coach, sharing that we always have a choice, and
Yes.
there's always options available to us. And taking chances feels scary, but it's not that scary.
No, I know. And it's so awesome when you realize this. So I want to get to the second thing that you said. You said so many good things in the opening intro. Honestly, we could have just stopped the podcast then. But I mean, I just want to have like dinner with you. I want us to go to dinner and like just share a bottle of wine, because I feel like we could just record that whole conversation, because we're so aligned in so many ways
Agreed.
right now in our life. But I want you to talk about when you said, like, I realized something, like, that I was approaching 50 or going into 50, like, what am I doing? Like, kind of that epiphany and that power that it gave you. Because I think right now, if you get on Instagram, you see all these messages of anti-aging and fight the aging and menopause is horrible and you're never going to feel good again and blah blah blah. And a lot of women are approaching that stage of their life like, ugh, I got to get everything fun done in my 40s. I'm never going to feel as good as I do right now. Can you talk a little bit about that and then tell us about your 50th birthday?
Actually, it's a very short story, but it leads into exactly what you're talking about. So my 50th birthday was coming around. I thought nothing about it. My sister got me a cake and I put it in the fridge. We did not talk about it. And yeah, that was my party. I was I ignored it.
Forget
I
it,
ignored
put
it.
it in the fridge.
Yeah.
Okay.
I never actually even thought about the number or the significance of it or anything like that. But the underlying thing is like, I don't want to think about this. Like, 50, what is happening? And it honestly, like, at the very beginning, it was like, I mean, it felt, I still don't even wanna, like, say my name, or say my age rather, because it
Mm,
just feels, like, old, and, like, I it brings up something in me of, like, a limitation or you
mm,
know, I don't know, and I think that that's what has been offered to us, is that at 50
mhm,
it's over, and I think
mhm,
there's been a lot of messages of, at 50 it's not over, that you have choices, that, now is the time where you don't have to care about a lot of things, and I think that is true, but at the same time, there's such an underlying, I don't know, is it shame? Is it worry? Is it, what are people are gonna look at me differently? I actually had a lot of underlying things that I had not really thought about till I looked at back and said, it's like, I really put that cake in the back of the fridge and I wasn't looking at it.
yes. I love this, and I love that you are so open about it, because I have felt similar, that as I approached 50, I was like, do I wanna make a post about it? Do I not wanna make a post about it? Oh my gosh, is it gonna, like, I literally had the thought, I don't know if you've had this thought, that, like, I'm gonna be excluded out of certain circles because I'm turning 50. And I don't want to exclude myself. And then I thought, oh, I'm not going to get asked to speak on stages, or nobody's going to want to hear from me, because that's what we're truly made to feel as we age as women, is that, like, when you age, you become invisible, you become irrelevant, you become out of touch, you become, you look worse, like, everything gets worse. And so we're just going to, don't push it that you're 50, because, like, if people know that you're in your fifth decade, you're suddenly, it's like almost like a disease or
Yeah.
something like you have. And instead of, it's like, oh my gosh, this woman is 50 and she's probably has such good and rich life experiences that we should want to learn from her. I've shared often on my podcast that I have friends in their 70s and in their 80s that are so impactful for me in my life. And I have those friends because a woman told me about 10 years ago, you need older friends. You don't have older friends, and all these business stresses that you're having about starting a business, all these other women have done, and you don't know that because you're not putting yourself in those circles. And if you put yourself in those circles, you're going to glean a lot of information from them. I want to
Exactly.
ask you about starting your podcast and your coaching program for women surgeons. First of all, women surgeons are some of my favorite people because I see you in a different way, because I get to work with you. I get to see how you're treated in the OR differently than your male colleagues and how resilient you all are. But you didn't just pivot and create your own private practice after being employed, but then you created this whole beautiful program for women surgeons. Can you talk about that? Had to be another stretch, another thing, another choice.
Exactly. And, it's all from very purpose driven. And it's that it's painful. It's painful to learn these lessons about dealing with difficult colleagues and being treated differently and dealing with complications and the shame and the worry associated with that. And,
Mm-hmm.
dealing with navigating, negotiating for yourself and dealing with the clinic. So those are the four, pillars of the program that takes a year to uncover all of these. And it's all basically things that were painful lessons to me. And if I turn my pain into a lesson, it becomes a purpose. And so
Mm.
that is another thing that allowed me to take chances, is that if I do something and I mess up and I cause myself pain, I can turn this into something that will cause less pain for myself and other people.
Mm.
And that's, I think, was the secret to taking risks, is to say that, I'm willing to feel any emotion. And I honestly think that's what confidence is the willingness to feel any emotion. I can feel pain, I can feel shame, I can feel worry. But as long as I'm doing this on the mission of finding something that's going to cause less pain for somebody else, I think, that's
Mm.
really honestly been the secret to taking chances.
Wow, that is so beautiful, Amy, to say. I love what you said, that confidence is the willingness to feel any emotion. And you talked about how purpose driven this work is that you do with women surgeons, and that you took pain into a purpose. That is beautiful. I mean, that's amazing. I think that your vulnerability to share that, I work with so many women surgeons that I see that it's actually difficult for me not to help them, because I see how that you come out very young and you look younger than your maybe male partner who's 20, 30 years older. You have less experience and you are definitely treated different, even if you are a woman surgeon who's been doing this for 20 or 30 years. But especially the young female surgeons, when they come out and they start their practice, I just see how different they're treated. And they seem to me, from someone that watching them work, that they either take a path of, I'm going to try to make everybody happy in this OR. I'm going to talk to the scrub nurse and the scrub tech, and I'm going to be like almost minimizing myself to be like the friendly, like, I need help. Will you help me? Can you do this for me? But almost like bringing cookies to work type. You know what I'm
Yes,
saying? Like
exactly.
pleasing everybody around them. And I see them take that path, because I think they think like, okay, I really need, this is really stressful today. I have a huge case. There's maybe some complications that I see in that could happen. And I need everybody on the team to want to help me. So I'm going to like put myself down as the doormat and be like less than, if that makes sense, in this power differential to make everyone come to like me. And then I see the opposite. I see surgeons who come in and you can tell they wear their stress. I mean, both of these are stress paths, right? Like both
All
types,
the
whether
stress
it's just how
response.
yes. And they're like, okay, everybody has to help me today. I need to like be super serious and like put my head down and I'm like trying to focus on taking care of this patient and I'm asking for things and it's not going well, or I'm in a complication and it's not going well and I'm getting angry, and then they just get labeled as the angry, like, what's wrong with her? She's so bitchy. Like, oh, we have to work with her
Yes,
today. And my heart is like bleeding on the other side of the drape because I'm seeing this happen and I'm like, okay, both of them are actually maladaptive responses to
100%.
simply being a woman surgeon. Like, almost like it's an impossible thing to be at times. Can you talk about that a little bit?
Oh, 100%. I mean, I think you nailed it. The main thing that to recognize, this is a stress response. So
Mhm,
there's a stressor and there's fight, flight, freeze, and fawn.
mhm,
And that explains most people's behavior. The people who argue, that's fight. The people that like they're ghosted or they give up, that's flight. And freeze is like, I'm here, but I'm not really contributing anything. And fawn is like, I'll do whatever you want. I'll be whoever you want to be.
mhm,
And so that explains a lot of behavior on both sides.
mhm,
And when we speak to the stressor and not the stress response is really where we make a big difference in how we interact with other people. But the one thing that I notice when I coach people that I've learned over the few years, one is recognizing it's a stress response and uncovering the stressor will get you moving forward. But also, usually we're either controlling our environment, how we feel, and missing the other person, the influence we have on other people, or we're so focused on the influence of other people, we do it at the sacrifice of ourselves. And so I
mhm,
think you have to look at both of those is like, what is the environment I'm creating for myself? And what is the environment I'm creating for other people? I think that you can go into the perception of the narcissist if you're only thinking of yourself and not looking at your influence, or the people pleaser who looks at everybody else and not themselves.
mhm.
So I definitely think it's that balance that can explain a lot of the lack of influence we have in the work, and also how we feel day to day.
And this is where I think it's really important to show that we can be allies to one another. I mean, I've many times spoken up in the OR and said, like, Doctor so and so is this, you guys, we are in a stressful situation. Please, let's all focus on helping this patient through, like, and affirm, or if I hear a nurse say, like, oh, she's so hard, she's so difficult to work with, I'm like, is she? I don't find her that way. I find her very focused and direct. And I like that type of feedback. And they're like, oh, because then it changes the narrative. Like, we as a society are so quick to jump to, like, this woman's difficult. This woman isn't a good leader because she's too soft. Like, unless it's just this tightrope that we all walk as women in medicine, whether we're an anesthesiologist, an internist, family practice, or whether you're a lawyer or whatever you are, we will have to walk this tightrope in the workforce that we need to try to be, like, direct, but not too direct, right? Soft and caring, but not too. It's this double bind that I'm sure you've read about and
Oh, yeah.
are aware of. And one of the
Yes.
ways that we can combat that when we're other women in the workforce is not to jump on that bandwagon, is not to be like, oh, yeah, she is really hard to work with, but actually to say, I think she is very direct. I like that type of communication style. When I'm in the OR, it helps me be less stressed because she's so direct and she tells us exactly what she's doing and what's going on with the patient. It just takes 30 seconds to change the narrative about someone. And recently I had an interaction with a surgeon that I was working in an area that I never work in, or I hardly ever work in, and working with a surgeon I didn't know. It was a very dark room. There was a robot going on. I came in to have a conversation with the surgeon about the next patient, and she she didn't know who I was. She thought I was a resident, which now is actually like a compliment
I
because
know, right?
I'm like, I'm so excited that she thought I was the resident physician. I'm 50 years old. But
Yep.
anyway, she kind of snapped at me and it was not great. But later she found me and apologized. And she said, I didn't know who you were. And so the next, like, day later, someone was like, wow, one of the nurses said, wow, I can't believe she talked to you like that. I'm like, oh, it was dark. She couldn't see me. It was a stressful part of the surgery.
Yeah.
And she apologized. We're fine. And they were like, oh. And all it took was 10 seconds of me changing the narrative. I could have said, like, yeah, that was rude, blah, blah, blah.
Yeah.
That's not going to help women in our culture where we practice in general. Like, just change someone else's narrative about them behind their, fix each other's crowns, basically. Like, let's uplift each other, because I'm sure, like, I've been the person to snap at people, and that's what I would want someone to do for me. Can you talk about that from the surgical side? What do you see going on there?
Yeah, I mean, a lot of times it's like they don't necessarily understand. It's a stressful situation for everybody.
Mm-hmm.
And and we have to like manage our own feelings about the stressful situation and our place in it. And sometimes these behaviors are kind of like, I hope she changes so I don't have to change how I feel. And
Mm-hmm.
so then, I mean, that is an opportunity to listen to someone and understand what's coming up for them, and because that's a response too, and say like something is stressing them. I wonder what it is that they're worried about. And that's, I think that's just carefully listening and asking good questions of saying, oh, but I think what you did was like offer is like, oh no, that's actually fine. And so then they get to feel a little bit better, because when something, comes up within them, it's their defensive on our behalf. And so that also
Right.
gives me a lot of insight into how they're doing in the workplace. And so not just can you reassure them in the moment, but it's an opportunity to say, why is this that, tell me a little bit more about the workplace for you. It sounds like, you have an opinion about the, the workplace here, and you can help that person not just feel better about how they perceive you as being treated, but you can also unlock something in them of saying like how you can understand the environment and not necessarily respond to it, or understand why you're responding to it even more helpfully, because you don't have to tell people what to do. You just show them that that they are having a response to something. Usually people, once they see it, can figure it out.
Well, and I love this about women also. I feel like, I know that in my career, I have had probably, I don't know, dozen, maybe 2 dozen women that are physicians that work not in anesthesia. So I work with, come to me after an interaction and say, can we talk about this? Or I'm sorry, or I wasn't my best. And I've probably had 5 men do that in 20 some years. Like, truly, I've had probably 4 times as many women, and there are, probably 20 to 80% is the breakdown in surgery, at least for women and men that in the world I work with. And certainly not even in cardiac anesthesia, it's even less. But I think that what we need to do, whether we're, male or female, and we're working in medicine, we need to assume positive intent. I have a good friend who's a surgeon, and he, really blew up at me one day in a very stressful situation that I've never had him treat me that way in 20 years. And it was so like shocking to me, because he's never treated me that way, that I was like, I have to say something to him afterwards. And I gave it like 24 hours, and then I asked him, and he just like fell apart. He like fell
Yeah.
apart. He told me all these things that were going on in his life. I had no idea that were going on in his life. And he basically said, like, I took it out on you because you're like a safe person to me, which actually made me feel good that he could be so blunt and
Yeah.
honest with me. But like, we just never know what's going on in someone's life. We never know what even happened 5 minutes ago in the hospital, or in our clinics, or in our workplaces, wherever we work, because we're just in the moment, and we just know what we need now. And oftentimes we don't give one another the grace to go, like, is everything okay? Like,
Yeah.
are you okay? It's
Yeah.
such a good question, because it comes, like you said, from a place of curiosity, right? To get curious about what is going on, and giving that person the breathing room to just be honest and go, actually, I'm not having a good day today, or I've just had a bad interaction, or I have a patient upstairs in the ICU who's not doing well, or whatever it is that comes up for them.
Exactly. I love that it's Bruce Perry and Oprah Winfrey. He has that book that's it says what happened to you,
What
and it's
happened to
asking a
you?
different
Yes.
question. It's like instead of what's wrong with you, it's what happened to you or what's happening to you,
Yes,
and
yes.
what it just changes the focus of the conversation of like I see you're struggling. Tell me about the stressor, and because we're just going to ignore the stress response. This is
Yes, yes, I love that, and that's so important, Amy, that you just brought that up again. I wanna make sure everybody heard that. So what we're really talking about here is we tend to judge the stress response and make it
Right.
mean something and put a narrative around it and an identity around it. But what we're saying is we should focus on the stressor, what is causing the actual stress
Yeah.
response, especially in a team environment. It's so critical, so critical. Okay, now I want you to chat just a few minutes about your coaching program for women. Can you talk a little bit to us about that?
Yeah, I decided it was gonna be a year. I know you've done programs. It's like, I don't know what's the right answer, this like that, but I really sat down and it's like, what would I have needed? And that's what
Mhm.
all of this is that I'm basically serving myself a few steps ago. And what I needed was to overcome like the different areas. And so it's very thoughtfully in approach. It's thoughtful in the approach, I should say. The first is 3 months of dealing with difficult colleagues. And what it
Mm,
is basically, how do you manage yourself around other people? And like, what do other people bring out in you? And then the next 3 months is about complications, is what do your actions bring out in you?
mm,
And then it's 3 months of power negotiating, which is how do you take your knowledge of what other people do for you and what your internal struggles, and how do you move forward in advocating for yourself, your patients, your career. And then it's all about, attention, negotiating, things like that. And then 3 months of stop hating clinic, which is this is when everybody's awake. We're learning how to manage other people. We're learning how to manage other people, and then kind of push these boundaries of things that we're told not to. It's like, oh no, doctors don't need to worry about the running of the business and things like that. But this is really about the time management and managing yourself in a stressful environment, and getting other people to help you. Not being like, we're supposed to be the leaders, but we're not supposed to do everything. And in fact, we rob other people of their ability to be good at their jobs if we do take things away from them. So it's
mm,
how do we then lose a little bit of control as we have other people help us, and we can't do it ourselves, which I think is a big struggle for the high achiever. And so it takes about a year to do these lessons. And I've had several people that actually been for a few years, because these lessons don't go away.
right.
And and I use a simple framework of the thought model that I learned in the life coach school. And also things have come up over time, things like, how to negotiate with the enemy and all these other lessons and little tools that I've learned over time. And, boundaries, which we've talked about before.
Yes.
Um, and I think that, people find you when they're on that journey with you. Um,
Mhm.
and I was actually thinking about your pathway. And I think that just like you said, that we're really aligned. And it's because, your books have really mirrored mine. I think that you take the lessons we have and articulate them well. And I try to do that for my program too. How your first book was like stepping into your power. And the
Yeah.
second one's like, you got to constrain this. I mean, they're going to
Yeah.
take advantage of you not. I
Yes.
mean, and then,
Yes.
when you had this new season, I had the same thing, like where I'm like, I wonder where she's going to go next because I need some answers. And so
Well, I don't
one of the
have all the
pathways.
answers, but I love sitting down and talking to powerful women like you who are all like, where are we going next? And we don't have to subscribe to this like we're aging, we're 50, we're
Yeah.
just whatever, we're, irrelevant. Like I just don't believe that. Like I don't believe that. I don't feel that. And I know you don't too. And so I love having you on today. Thank you for sharing. We could just chat forever. I
I
wish
think
that
so
we
too.
worked across the drape from each other so we could have every day would be the most empowering, fun day. Like, can you imagine? But
Because
I
I
want,
couldn't imagine it'd be amazing.
oh my gosh, it'd be so fun. We would probably get in trouble for not being fast enough. People would be like, can you hurry up? Like, come on. Um, so I do want you to share where our listeners can find you, where they can hear about your podcast, your programs. Tell us where we can get to know you online.
It's pretty easy. The door is open at excuse me. The door is open at bosssurgery.com. That's where you can find the book that I wrote, the podcast. We just had our 200th episode, and I have amazing friends like Dr. Sasha Shillcutt that was on there, and hope to have her on again. And so the podcast is there, and also my coaching program is there. So it's the Boss Surgeons program.
Awesome. Well, thank you so much for being on the show today. And if you were listening, we said so many good pearls just to wrap up that our guest shared with us today. Dr. Vertrees reminds us that we can take chances, that we have more agency than we know. that you get to decide. As she said, I decide, and that's a strength. And you can take risks. You don't have to subscribe to the way that everything has been. And also, just the beautiful reminder that confidence is the willingness to feel any emotion. And if you're willing to feel any emotion, your emotions don't really control you, but you grow in strength and resilience as we walk through those emotions, even the hard and the negative and the stressful ones. Thank you so much again for listening, and go be brave.